So good morning and a warm welcome to today's webinar from the UK Climate Resilience Programme. My name is Kate Lonsdale and I'm one of the two champions for the programme along with Suraj Desai, and we're based at the University of Leeds. And today's webinar is focusing on overheating in care homes, and this webinar is one of a series of webinars that we run through the programme that was set up to communicate the research findings funded through the UK Climate Resilience Programme. And if you're new to the programme and are interested in finding out more about what we do and details of the projects funded and latest news and previous webinars and newsletters that are archived on the site, then just take a look at the website. There's a lot of information there and it's regularly updated. So today, the focus of today's webinar is on overheating in care homes, and it's based on the pilot work of Professor Mike Davies and his team that's been funded through the UK Climate Resilience Programme, which they're now continuing through a longer study. Before we hear from Mike, I've got a few bits of relevant news for the programme, then we'll move on to Mike's presentation, and then we'll have a response from April Cole on the relevance and value of this research to her work at the Care Quality Commission. Then we should have about 20 minutes for questions and discussion, and both speakers will be available to answer questions. So to feed the discussion, we encourage you to ask questions, and we're using the Q&A function for questions rather than the chat. So please add your questions as they occur to you through the presentations. You don't have to wait till the end. And we encourage you also to upvote other people's questions that you like the look of, you'd like to hear answered. As participants, you remain muted unless I unmute you. The webinar audio and the slides will be shared after the event and will be available through our YouTube link, which you can get through the website. If you have any tech problems, which I hope you don't, please use the chat and we'll do our best to help you. And just to remind you that the webinar is being recorded. So a couple of items of programme news. The UK Centre for Ecology and Hydrology, CEH, will be hosting an online workshop on the 29th of April from 10 till 12. And this is to introduce their new socioeconomic scenario data sets and products for the UK. So these have been developed with programme funding and to support future research and policy on UK climate risk and resilience. So to understand risk, you need not only information about climate hazards, but also about the exposure and vulnerability of the systems that you're interested in and care about. So that could be livestock or transport systems or people in care homes. And so these new scenarios incorporate a wide range of possible socioeconomic change drivers and are consistent with the shared socioeconomic pathways of that the IPCC next assessment report will be using. At this event, they're not only sharing the results of their work, but they're also keen to discuss how the scenarios and other products might be used and get feedback on how to make them widely available. Another bit of programme news. So Freya Gary and some colleagues at the Met Office published a report recently on compound hazard events and the implications for UK agriculture. And this has just been receiving quite a lot of media attention in the last week. So it's about looking at the impacts of on livestock heat stress and particularly on potato blight. So there's a couple of examples here, the Scotsman and Farming UK, but it's also appeared in Sun Online and the Telegraph and iNews. And then a bit of sort of wider news beyond the programme. A new report was launched last week by the place-based climate action network PCAN, and it's about trends in local climate action in the UK, and it's available to download from their website. And it shows that there's very strong and broad-based support for more climate action, but the ability of local authorities is limited by lack of capacity and expertise, and also COVID, of course. But more positively, there's a growing interest in partnership-based approaches to local climate action and a growing number of local climate commissions, action networks, and participatory forums like climate assemblies and climate juries. And so it's well worth having a look at that. So let's move on to the focus of today's webinar. I'm now going to pass over to Professor Mike Davies. And Mike is Professor of Building Physics and Environment at UCL and the Director of a multidisciplinary complex built environment systems group at UCL. And he's a member of the Adaptation Committee of the Committee on Climate Change. And his specific research focus has been on the provision of healthy and comfortable built environments in the context of a changing climate. So welcome, Mike, and over to you.
Thanks very much, Kate, and good afternoon, everybody. I'll just share my screen. Can I just check that, Kate, can you see the screen okay?
Yes, it's fine.
Great. Okay, well, yes, hello everybody again, and thanks again to Kate for the kind introduction. So yes, I'm just going to say a few words about our climate care project in relation to overheating in care homes. So in the presentation, I'll give a little bit of background as to why we think this work is important, why the issues are important. Kind of a summary of the overall project, and then a brief description of the methods that we are employing, and then just some indication of some initial outputs from both the pilot project and the main follow-on project, and then just a few words about next steps. So I think probably everyone on the call obviously is aware of the kind of main central issue that the UK, as a result of anticipated climate change, is expected to experience hotter and drier summers and have a greater frequency of heat waves that will be more intense and longer. Of particular pertinence to the climate care project, the UK also has a rapidly aging population and also growth in single households, leading to potentially increased demand for care provision in old age. And vitally, older populations are more vulnerable to heat stress. And again, with regards to actual care settings, the indoor environment is particularly important as a moderator of heat exposure for older populations who really spend the vast majority of tend to spend the vast majority of their time indoors. And we already have some evidence that new build care homes, for example, are overheating even under non-extreme summers. And it is likely that these risks will increase due to ongoing and future climate change. So I guess we kind of argue that there was a lack of a really kind of simple and easy to implement guidance on how to design new build care settings, but also to retrofit existing care homes in order to respond most appropriately to a changing climate. So that was the kind of background and the basis for the work. So the project itself, it's a very interdisciplinary project. And I mentioned the pilot project that ran for a year. And then we were very fortunate to be funded for a follow-on project. Both of the projects we're kind of calling under the climate care umbrella. So you can see there, hopefully, in the bottom right of the screen, both the academic partners, Oxford Brookes, LSHGM and UCL, but also the kind of vital group of project partners who have been absolutely invaluable in helping us to do the work we have, but also to kind of think about how to make the work as impactful and useful as possible. And Kate mentioned that April Cole from the Care Quality Commission is very kindly on the webinar today to follow on from my presentation and to respond along with me to the questions following the presentation. So the aim of the pilot project, then, if I can just talk about that for a few moments, was to really, well, as a pilot should, I suppose, undertake feasibility work to help us plan for a larger scale project. It had 5 main objectives. The first was to carry out pilot work in 5 London care homes. That would involving monitoring work, monitoring of temperatures, and also surveys with staff and managers and residents in the care settings. Test some approaches for trying to understand the comfort levels of care home residents. Testing measurement techniques for assessing the impact of heat exposure on the health of the residents, so measuring temperatures again. Undertaking building performance computer simulation work to test out methods to assess future overheating risks in care settings, but also what interventions may be the most appropriate to test a range of possible interventions to address these high temperatures in the summer. And really kind of overall to pull together this multidisciplinary aspects of the research in partnership and close partnership, close working with the care home practitioners and those other stakeholders and project partners that I highlighted earlier. So with regard to the case studies, as I mentioned, there were 5 that we managed to recruit with great help from the CQC. You should see there on the right a map of London. It may not be particularly clear, and we're just trying to preserve the anonymity as I guess as much as we can, but by these rather large dots. But they were spread across London, and they had a range of characteristics. You can see in the table at the top there, in terms of their occupancy, the type of building they were, and the type of construction, and also their age. So ranging from very old building which had been adapted to relatively new purpose-built care setting. And as I mentioned, with different occupancies ranging from just a few up to over 100. And importantly, in order for us to be able to explore some of the reasons why some homes perhaps perform better during periods of heat, these different types of constructions, from a very kind of heavyweight older construction to rather more lightweight modern constructions. So we thought that would give us a reasonable spread of the type of care homes to test out some of these methods that we hope to deploy in the larger project. So I mentioned that we undertook monitoring. You should just be able to see there's one of the loggers, and these were put into the care homes, and we measured temperature, relative humidity, and carbon dioxide levels. The Oxford Brookes team led on work with a survey to record the perception of thermal comfort of residents during hot days during the 2019 summer, and also undertook a series of semi-structured interviews with the residents, but also the care home managers and the staff, to try to understand what practices were in place in the various care settings. Alongside the monitoring, we undertook some modelling work, some computer modelling, and for that we used the open source tool Energy Plus, and we operated that via the Design Builder interface. And we were fortunate enough to be able to liaise with colleagues at the Met Office to get some advice about which weather files we should use to drive this simulation work. And we settled on the following. We used CIBSE weather files, Chartered Institute of Building Services Engineers weather files, design summer year, that's DSY files, and they were based on the UK CP09 projections. So we used a weather file from central London and one more towards the outskirts of London, and for different timescales. So current 2020s, and then another couple of weather files that were intended to represent 2-degree and 4-degree future worlds. And these models take some time to build, and sometimes a lot of time to gather the data to build them. And part of that involved doing building physical service of the building during visits to the various properties, and then building these thermal models within Energy Plus, and then running the simulations driven, as I say, by these series of weather files. And the outputs from that were internal temperatures, and we were able then to test or to compare these predictions against the measured temperatures in order to give us some confidence that the models were useful. And then we made changes to the models to look at different types of interventions that were all aimed at intervening during the summer periods to reduce temperatures during those periods of heat. Apologies if that text on the left-hand table is rather small, but this is just intended to demonstrate the range of type of interventions that we investigated with the modelling work. So you might see the broad categories there, A to F. So the base case is what it says, I guess what it says it was, that was the building as it stands. And then once we'd tested it against the monitored data to gain some confidence in the model, we then introduced these different types of interventions, all aimed at reducing temperatures in the building. So minimizing internal heat generation, actually keeping the heat out, managing the heat, and using more passive ventilation techniques, and then bringing together a combination of those different types of methods. So you may see there, for example, keeping the heat out, the application of solar window film, and using different types of glazing, for example. So a whole range of different interventions which we tested with the modelling work. And on the right there, they included both kind of soft, non-structural interventions, so different window opening regimes, for example, alongside the kind of harder structural engineering solutions. And I'll mention it briefly at the end, but we also had some initial work looking at the costs and benefits of these interventions. And there they are, really just in a kind of different form. They're just a kind of more visual form, the different types of interventions that we looked at. In the initial phase, we didn't look at the bottom left there, the green-blue infrastructure, so changes to the external environment, although we do plan to do that now in the main study. So these were all, as I say, the type of interventions that we explored with the modelling work. So just looking at some of the preliminary outputs. So from the monitoring work, this was work that was monitored in 2019. You can see the kind of plot of daily average temperatures on the right, and the one of the key outputs from that first period of monitoring was that these daily temperatures were significantly higher than during these periods of heat, at least, than the 26 degrees C threshold that's recommended by Public Health England. And it would also seem to be the case, albeit a relatively small sample, that the older, heavier wet buildings seem to perform a little better, and the occupants were less likely to feel hot during these summer periods. So that first slide was about the monitoring work. Here are some results from the modelling work. It may be a little bit complicated here, but again, here are these different categories of interventions: A, B, C, D, E, and F. And this is for the newer care home, and this is for the older care home. And here is the base case under the different climate scenarios. So this is present day going towards the future, and the different range of interventions that were applied. And you can see the kind of scale of the impact that it had in reducing temperatures with these different types of interventions. Again, a very small sample, but the older buildings appeared in the ones that we looked at to benefit more from the application of high albedo materials, so rather more reflective materials on the outside of the building. And again, in this small sample, the newer buildings seem to benefit more from increasing the ventilation rates and providing external shading systems. But probably too small a sample to generalize too much from that small sample. But some interesting results nevertheless, we hope. And overall, the most impactful measures seem to lie in the area of passive ventilation and managing the heat. And this is just another way of representing that. Here's those interventions again, and these are the type of temperature reductions that were seen during the 5-day heatwave period via the introduction of these types of interventions, either singly or as in combination. So yeah, just a few of the findings from that then. I mentioned that the mean internal temperatures in all the 5 case studies remained predominantly above the 26 degree C threshold, which Public Health England recommend, and increased further, and not surprisingly perhaps, under the future climate scenarios. The combination of these soft and hard engineered strategies were effective, and you can see the kind of range there from over 1 to over 4 degrees C temperature reductions seem to be possible from the modelling work. I've mentioned really what the difference between the older buildings and the newer buildings, and how different interventions were more effective in each of the different cases, and how night ventilation seemed to be very important, but not without its difficulties in implementation, which maybe we can speak a little bit more about in the discussion if you're interested to do so. So that was the pilot project, and in the just a very few slides on the follow-on, the larger project. So we're now going beyond the 5 care settings and planning to look at care settings nationwide, and really kind of working to generate impact along these three main pathways. So you can see on the right there, so by really providing building construction practitioners, hopefully with useful information, and we're working very closely with CIBSE, Chartered Institution of Building Service Engineers, for example, to enable us to do that. And the second pathway, working with policymakers, and again, you saw the MHCLG, for example, being involved in providing great support, so thank you for that. And of course, the final pathway, by working very closely with the care home managers, staff themselves, and hopefully providing them and the residents with useful guidelines in terms of how to operate the care homes during these periods of heat and in a warming climate. But of course, I need to mention the impact of COVID on this. The project was awarded back in May last year, and it was, of course, I think clear by then that we would be unable to go into the care homes as planned during last year's summer. We were able to go in the care homes in 2019 for the pilot study, but not in 2020 for the main study, unfortunately. And it was, of course, very difficult, completely understandably, to even really, it wasn't appropriate to engage with care homes for a very long period. But now, with the help and advice and support of the Care Quality Commission, we are currently engaged with them and recruiting for some kind of monitoring, which will be a kind of revised protocol of monitoring, I think, largely done remotely for this summer. So we're hopeful that we'll be able to do something this summer, but again, it's unlikely to be the kind of full-scale field work that we had planned. Just in the final couple of minutes that I've got left, I just wanted to run through some work that we have been able to do on the in the main project. Whilst we've been unable to go into care settings themselves, we've taken advantage of the opportunities to undertake some work relating to the costs and benefits of these interventions that I mentioned earlier. And in fact, we just had the good news just this morning that the paper that we submitted to Climate Risk Management has just been accepted regarding this. So you'll, I think, just be able to see the details at the bottom there, and apparently that should be online very shortly. So I'm just going to run very quickly through a couple of the some of the methods relating to that as the final few slides of the presentation. So just a reminder, really, that as I mentioned at the beginning, age and frailty are really kind of key determinants of heat-related mortality and morbidity. And there is direct evidence that elderly residents of care homes are particularly vulnerable during periods of heat. There is, however, uncertainties about the degree of this rather kind of unfortunate term harvesting. To what extent are people's lives cut short by these periods of heat? So in this paper, more of a kind of methods, more of an emphasis on the methods in this paper, and it was led by colleagues at the London School of Hygiene and Tropical Medicine. We tried to look at implications of the uncertainties regarding to the degree of harvesting related to the cost-benefit assessment of these interventions in care homes. So colleagues at LSHM used three methods, therefore, for estimating mortality risk and life expectancy: standard life tables, and then life tables which were, but that's for a kind of, if you like, a kind of standard population, i.e. those who are not in care, not in care settings. So then the second option was to use life tables which have been scaled to fit care home survival on the basis that they were these people were likely to be more vulnerable. And then a third method, the third option, was to simply apply a kind of standard 6 months life expectancy to the particularly vulnerable population of in the care home. So three different methods to give some kind of indication of the implications of these uncertainties. So I've got drafts plastered over this. As I mentioned, the paper's now been accepted, but please still just treat these as draft for the moment. There's a lot going on in this table. If I can just explain very briefly what it represents. So I mentioned weather files before. These are two different types of weather file that we used for a hot year and an average year. And then that's replicated for these three different types of assumptions for life expectancy in both cases. We undertook modeling to understand, and this was for just some simple shading devices, what the impact of those shading devices would be on reducing temperatures during this hot period. So by almost a degree here, and almost, well, about just over half a degree during this cooler year. And then the colleagues at LSHM undertook the work via the live tables and various assumptions for the risk ratios to, in this example care home of 50 residents, how many heat deaths would be averted by that intervention? And these are fractions of heat deaths. So therefore, how many life years would be lost each year in that care setting of 50 residents before the intervention, after the intervention, and therefore the difference being these averted life years. And then this was monetized very simply using the value of £30,000 per quality adjusted life year. So this was, for this particular line, and as an example, that particular intervention each year is the monetized value of the life years, lost life years averted, just under £9,000. And then I think we took a 20-year time horizon to understand the overall implications of that benefit. And then we were able to make some estimates of the cost of those shading interventions to sit alongside this. And the results, as it says there, suggested that these interventions, in this case, even the shading, the kind of relatively simple shading, have the potential to be cost effective and really should be considered as even with its relatively simple basis of just taking health as the only benefit, should be considered as an important complement to operational responses from the care homes. And we also hope that the work, generally, the kind of methodological basis of the work will be used to improve assumptions in assessing the cost benefit of these adaptation measures. So we hope this will be the basis, and we've got a series of papers now planned to look in more detail at this for a whole series of interventions, of which we've already, to a large extent, done the modelling work, but we need to refine and to look at, to improve it in terms of the treatment of the weather files again, and so on. But we hope that that will provide a robust evidence base for decision makers. We have a website if you're interested. That's there. It's also given on the last slide. We've also, in collaboration on the left-hand side there, sorry, on the right-hand side, but the left-hand side of those two reports, worked with the GLA, Mayor of London, to input to a relatively recent report, and also worked with CIBSE to produce a research insight of the initial findings from the Climate Care project. Got a series of publications which are now starting to come out of the work, and they're all available if you'd like. They should be generally available, but if you can't find them, you're very welcome to contact me and I'll send you a copy. And there's my contact details and the website again. So thank you very much indeed for your attention, and I'll stop sharing now and hand back to Kate.
Brilliant. Many thanks, Mike. So there's a lot of really interesting issues being raised there. So I'm encouraging everyone to start asking some questions. We'll have about 20 minutes for discussion in a minute. And now, but before that, we're going to hear from April Cole. So April is a policy officer at the Care Quality Commission, and she's got a background in public affairs and communications, and has been working in the health and care sector for nearly 20 years, specifically in policy for the last 7. So April's going to tell us a bit about what this research means for the Care Quality Commission. Thank you, April.
Hi, thanks, Kate. Thanks, Mike. So as Kate mentioned, I work in the adult social care policy team at the Care Quality Commission. I believe there are some providers on the call today. Hello. For those of you who don't know us, the Care Quality Commission is the independent regulator of health and social care in England. It's been in place since 2009. It was formed by the merger of 3 predecessor bodies who had previously independently regulated hospitals, social care and mental health. And CQC has a clear purpose, which is to ensure that health and care services provide people with safe, effective, compassionate, high quality care, and to encourage those services to improve. So CQC was delighted to be asked to participate in this project. We sit on the advisory board. I think we have sat on that board since about 2018, and I was debating that with Mike just prior to this webinar starting. And we have participated in, we've helped assist in finding participants for the project. So as has been mentioned, evidence is growing around the impact of climate change and sustainability, and will increasingly need to be considered by providers to improve care. CQC is routinely asked about excess in adult social care due to extreme cold weather, but as Mike has mentioned, evidence is starting to highlight that hotter summers are beginning to drive similar mortality peaks as well. So I think It's really important to flag at this point, this sector was facing very big challenges prior to the coronavirus hitting this time last year. So they've faced quite severe cuts funding, and workforce shortages were already issues prior to COVID. So I know that this is an area that providers are very interested in, and indeed some of the larger independent health and social care providers are already have their own policies on this, um, and commitments to environmental sustainability. And hopefully I'm not teaching you all things that you already know, but many local authorities already signed up to climate change targets and support the UK government targets. But so they may be reflected at local levels via individual contracts with social care providers. But I think it's fair to say it's not been their top priority over the last 12 months. I just wanted to set that context. More broadly, the NHS has the more joined up national approach on this currently. So CQC is a member of the cross-system group that is due to refresh this year, that is looking at as part of for a greener NHS strategy. To date, this has only encompassed NHS services. So that means currently that neither social care nor independent healthcare sectors, except where they are delivering NHS contracts, are currently covered by this strategy, but hopefully that scope will be widened over time. That group brings together a range of systems actors at the UK level to report on and coordinate actions on delivering environmental sustainability targets. But at the CQC, we consider temperature and hydration in our inspections as part of ensuring a safe environment. So our quality assessment framework provides for this within the theme of safety, and it contains some key lines of inquiry which are supplemented by more detailed prompts. They focus on the importance of people experiencing a safe environment that is responsive to their personal needs. So when we go out on inspection, our inspectors are looking for assurance and evidence of safety at an overall level, and then they explore in detail any areas where concerns have been raised either before the inspection or during the course of the inspection. We have less regulatory power in some settings in relation to building regulations. Some providers only lease premises and have rental agreements and are unable to make structural changes. I know in phase 1 of this project, there were the providers that were in purpose designed buildings that were only a few years old, and there was the one building conversion that was it from the 14th century? That's, as an Australian, that still blows my mind. But however, if we have any safety concerns, we would escalate that with the provider and also with the relevant authorities such as the fire service and the health and safety executive. So previously we have run campaigns around temperature awareness to raise the awareness of the importance of ensuring people in care homes and healthcare facilities are appropriately monitored and health supported during hot weather. We also direct providers to some of the resources that are available through Public Health England, and the Care Providers Alliance have also put out guidance on developing contingency plans for adult social care. But our quality assessment framework is currently, including the sources of evidence, is actually currently being reviewed, and strengthening environmental factors is one of the key areas that we've specifically logged for consideration. We're also have just finished consulting on our new 5-year strategy, and the environmental factors do align to the theme within that. So in that document, we specifically state that we will look at how services meet their social and ethical responsibilities, such as environmental sustainability, and that includes how they benefit local health and well-being, society, the economy, and the environment. Although I'd like to stress there that they are not in priority order. And I think the Climate Care project is going to provide evidence to support the key themes within that strategy around smarter regulation and safety through learning as well. But I think it's fantastic that phase 2 of this project is hopefully going to be able to commence soon. And that it's been expanded beyond London as well. So the way we have been involved is we have the inspectors in the targeted research regions, so in this specifically Newcastle and Manchester, as well as London. They're speaking to individual providers at the moment to that have expressed an interest to us in the past, but also we have been flagging it to them to see if they're interested, and we've been passing their details back to the research team. We also have a corporate provider team that do a lot more relationship management with the larger corporate providers, and that can be they're very useful sources of information as well, because they have multiple services in multiple locations, and so we are hoping to recruit some from that. We also have a provider bulletin that goes out to I think it is in the region of around 20,000 providers. So we do provide updates through that, and with calls for recruitment through that as well. We have also had, at the end of phase 1, we had a Rajat from the advisory board from Oxford Brookes came along and gave a presentation to our leadership team. We're sharing the information, the good practice throughout our organisation as well. And we're keen to share the good practice and the findings as they come through out through our bulletins and to providers as well. So I think that's about it for me, really. But I'd just like to say thanks for inviting us to speak today, and we really look forward to continuing to work on this project.
Brilliant. Many thanks, April, and thanks, Mike. So we're now going to move on to the next phase, which is questions and answers and discussion. And we've got some questions coming in. And I'm just going to give a little bit more time for people to write down questions and ask. Right at the end, Mike, you mentioned about night ventilation, and I just wanted to, if you could say a little bit more about that, about how you might achieve that in a safe way, because you said that was going to have a big impact, maybe.
Yes, well, I think that you've kind of hit the nail on the head there, really, about this issue of how you actually. So, the building physics demonstrates that there are big advantages to be gained by having the windows open at night and increasing the ventilation rates, and then assuming that the temperatures do drop off at night, you can then kind of cool the building during the night, and then obviously that will have an impact during the beneficial impact during the next day as well. But and I think maybe it's connected to one of the questions, maybe from Simon there as well. In terms of actually implementing that, then in the surveys, and this I think has been reported in one of those papers on the list that Rajat and his team at Oxford Brookes led on. It's in Building Services, Engineering, Research and Technology, the paper there. In the kind of survey work that was undertaken, I think it was reporting that the windows tended to be closed at night by the staff for kind of both safety, but also potentially related to this. I think what Rajat's called this kind of culture of heat, that there's a real kind of focus, maybe this isn't in general, but that there was a potential kind of focus on making sure that the occupants are kept warm, and perhaps not quite as much focus on on the potential for overheating. So I think it wasn't necessarily all the case in each case that these windows were opened at night, despite the potential. But there's also the issue that I think in many instances, or maybe all, there is a limit to the degree to which the windows can be opened from a safety to prevent people climbing out and so on, and maybe and also issues of, I guess, more generally of security and noise, etc. So there's a whole range of kind of practical issues why it might be difficult to implement night ventilation, but if they can be thought through and addressed, then the potential to reduce temperatures is significant.
Mm-hmm. So generally, the issue of who got control in response to Simon's question, it was generally the carers, you're saying, or
a relatively small sample again still, but that's my understanding, and I can certainly follow up on that with you and others who are interested. And I think there's a bit more detail given in that paper that I mentioned. I'm sure Rajat would be happy to come back to it, but I don't think that was a hard and fast rule necessarily, but I think that was certainly something that was observed. I don't know if April's got any thoughts on that.
I think it would, if we can capture that in phase 2, I think that would be quite interesting. Certainly we'll once the list is confirmed, we will make sure the inspectors for those particular services know that they're taking part in this project.
Great. So there's another question here about, please could you say a little about the active involvement of older residents in the project and how this was achieved or potentially will be achieved, I guess, in the second phase?
Yeah, well, again, I can give it an initial go. there was, I mean, I think it, you know, there's certainly more that we could and should be doing, I think, in terms of active involvement. The residents were certainly engaged via the interview work and the you know, the opportunity to talk about their experiences and to report on their comfort levels at different times. I think in terms of shaping and kind of helping to co-create the research, then I think, you know, there is the potential now to kind of learn from those conversations and how we might set things up in the second phase. Although I think the opportunities might be somewhat limited, because we're probably going to, we will probably have to rely initially, at least, on posting these loggers out and having them installed, and the opportunity to engage as, you know, closely with the residents is going to be limited, I think. So that's, hopefully that doesn't sound like an excuse, because I think it's incredibly important that the work is co-created, but certainly an issue that, you know, we have tried to make some progress on, and no doubt we could and should be doing more. And I think, you know, that was the plan, but whether or not we'll be able to do it this year is remains to be seen.
There's a question here about this. Michael Sanderson saying he'd seen various papers looking at indoor air pollution recently. Do you know if indoor air pollution is also an issue within care homes, or is heat the biggest issue in terms of mortality?
Well, my feeling is it will be an issue, but climate care isn't explicitly focused on it. But we and, you know, other research groups have certainly done work on the connections between indoor air quality and well, indoor environmental quality in general, that incorporates both indoor air pollutant concentrations and overheating. And whilst we haven't done the work explicitly yet for care settings, we have done it for you know, homes in general. And I think papers led by colleagues Jonathan Taylor and possibly Anna Mavriani, and I can dig them out, they're fairly recent, looked at the possible trade-offs between window opening to help this issue of ventilation, how it could help from an overheating perspective, but depending on your proximity to busy roads, for example, it might tend to increase concentrations of NO2 and PM2.5. And there's quite a kind of complex trade-off there as to overall what's better for your health. So from a thermal comfort perspective, it's probably better to open the, you know, that would be helped by opening the windows, but there would be a potentially negative effect of introducing external pollutants. But even more complex than that, it would tend to reduce the levels of indoor generated pollutants with a health benefit. So you have got this quite complex set of interactions happening, which we're not explicitly addressing. We have done in for the standard kind of housing stock, but not for care settings yet. But it's definitely something we've discussed and think would be particularly interesting to do. And I'm really keen that we do try to explore in this project. We can, and the model, the Energy Plus models, once they're set up, we can run them to incorporate predictions of pollutant concentrations by setting up emission rates in the building and assumptions about external concentration. So it's definitely possible to do it.
Is there anything you'd like to add on that, April?
I think yeah, our inspectors aren't looking at in that level of detail just yet. I did feel like saying in my response to the providers on the call that they're not looking at averted life years just at that level of detail yet. But yeah, it's something that we're keeping an eye on more broadly. In the assessment framework, we need to keep it sort of high level and dive in more deeply as it's needed.
Mike, the group that, I mean, this looking at older people obviously have a number of particular vulnerabilities, but do you think the kind of approach that you're taking and the findings and the sort of methods you're using, do they have transferability to other groups, do you think, or other settings?
What kind of settings are you thinking of here, for example?
Well, I mean, it may be offices or domestic settings or sort of public buildings.
Yeah, I think there is a certain degree of transfer, but, you know, with that, and I think a lot of the assumptions about thermal comfort, for example, do assume that you have the ability to adapt and you can make changes to your environment. And it might be that that's less possible for people in residents of care homes than it is in a person who's in their own home. So and it may be, and it almost certainly is different for people in office environments as well. So I think there are differences, but there are similarities. And the Chartered Institution of Building Service Engineers, who I've mentioned several times, have got guidance out for both kind of office, well, non-domestic buildings and domestic buildings. And now we're trying to add to that with the, I guess, the specific issues that relate to care settings. So there are certainly things in common, but I think there are also important differences.
Mm-hmm. Okay. So you've mentioned a few times that this is a multidisciplinary piece of work, and you're a director of a multidisciplinary team at UCL. So what reflections do you have about working in an interdisciplinary team through this project? So reflections on sort of what are the success factors for that? What's worked well, and also how do you make sure that what comes out is useful and usable in a decision context?
Yeah, thank you. It's a very good question. I mean, firstly, I think it's very, very difficult to do it, and I'm certainly not claiming that we're doing it perfectly. We're far, of course, far from perfect, and it's extremely challenging. And I think it requires, a huge amount of work to do it. If people are interested, my colleague Helen Panillo has recently published a paper on, I think it was transdisciplinary working, and they're all on a spectrum, and I think transdisciplinary was even kind of further to the one end than a multidisciplinary, about these challenges and how she's interviewed and done reviews of how different projects have attempted, with degrees of failure and success, to work in this way. So that's an interesting and hopefully useful paper, I think, that we're going to try and use. Not necessarily in this project so much, but we will try to bring it in as an evaluation of this project if we can, but to try and shape ways in which we set up projects and then operate them to hopefully make easier this very challenging into multi-transdisciplinary ways of working. We have worked with, well, both the academic partners have worked together in the past, and with the London School, we've been now working together, I don't know, 12, 13, 14, 15 years. So it makes a big difference working with, I think, partners who you have already established, not just working relationship, but I guess a degree of trust, and you're able to talk openly about the failings of your ways of working, as well as the plus side. So I think having that kind of open and trusting relationship between and the academic partners is very important, and also trying to build that relationship with the other project partners. And April mentioned that we've been working with the Care Quality Commission just for a few years now, but I mean we're hoping that this will be a long-term relationship, and we're learning all the time about what might be useful and what might not, what might just be potentially an academically interesting paper, and how could that be used in a way which could actually be useful to a body like the Care Quality Commission. And equally with the Public Health England, we've been working with them for a long time now, and Emma O'Connell and Owen Landig and the colleagues have just been fantastic in helping us to kind of think about how the work should be framed. And we've been looking at the type of guidance they've provided and how they've framed that to, I think, try to understand how the work can be communicated in a useful way as possible. So I think there's lots and lots of different ways that make things more successful than not. But the overall thing is, I think it's extremely challenging, and it requires a huge amount of work just working on that multidisciplinary side all the time to try to make it work. It's my experience anyway.
April, have you got any reflections on what makes working with academics useful, usable?
I found all of the people I've worked with on this project very approachable and helpful, and it's quite often you get approached for things and there isn't enough time to be able to do what you'd like to do. And on this, that hasn't been so much of an issue, which has been great. There's always been quite long time scales. So I know we do a lot of co-production at the CQC on our guidance, and it's been a key part of our adult social care policy work to ensure that we are trying to get people's feedback and co-produce our guidance. But I would just say that I've found over the last 12 months in the pandemic, people are, I think, speaking more openly, and I'm finding some organisations and departments where I might not have it might have been slightly more difficult in the past. I think that it's been interesting that the less we've been able to meet in person, the more open I found people online. That's just a personal reflection, but I've been quite surprised by that. It's been great.
Yeah,
Positive of a lockdown.
Yeah. Right, some few more questions coming in. So there's one here about sort of the link between the sort of adaptation agenda and the net zero agenda. So from your research, to what extent will mechanical ventilation be needed to mitigate overheating in the near future, and what would the effect on this for net zero targets?
Yeah, I mean that's we've there's another paper that we've just submitted to Energy and Buildings, which I think is with the reviewers now. We might have just got it back with some comments, and that is looking at the cooling energy demand of different intervention approaches. So it is something that we, and I'm sure other groups, research groups, are looking at as well. So yes, this combination of the type of approaches that I've described here, these kind of more kind of passive approaches, and when mechanical ventilation and air conditioning may be required is critical. And we've, as I say, if it's of interest, well, hopefully if that paper's published, we can pass it on. But I'd be very happy to speak to the person who asked the question about our initial findings so far on that. And yeah, it is an important issue in general, not just for the care home stock, but for the general housing stock. If there's a large movement towards air conditioning, then it will have clear, negative implications for the move to net zero. So it's definitely something which is of kind of much wider interest as well. But I guess on the other side of that is to say that air conditioning does provide a very kind of effective, kind of cool, and potentially provides a cool and safe space for care home residents to be able to possibly move to during periods of intense heat. And we wouldn't argue against the room being heated adequately during the winter. And so I think there are some important discussions to be had about when the use of mechanical of air conditioning would be appropriate, given its potential to protect against during periods of overheating. So that's a very good question. Not a simple answer other than it's definitely the sort of thing this project is looking at. And as I say, I'm sure other groups throughout the UK and internationally are also looking at that as well.
April, is there anything you'd like to add about how the CQC is thinking about the sort of net zero agenda and the resilience agenda?
I think we will certainly be considering it as part of the next strategy that's in the process of just being finalised now. But I think I have colleagues who work on the NHS side who are doing more on it and are further ahead than we are in adult social care. So yeah, watch this space.
Great. So will the next phase be looking at resident behaviour? So behaviours like clothing, movement, food and drink for cooling, bathing. So will that be included in the modelling in the next phase?
Yes, some of those issues we can explicitly include in the modelling, and others we can't necessarily explicitly model, but we could. And I guess that's part of the approach, is to try to pull together different strands, drawing both from the modelling work, but also more on the kind of qualitative side of pulling in, from the interviews with staff and residents, what might be effective interventions. So I think I mentioned in the brief description of the modelling work that these kind of soft type of interventions, which possibly in there could be the kind of clothing and the movement. Well, what we've generated, I think, in those outputs, I didn't say it explicitly, we're kind of a weighted average, I think, of the different rooms that people are in at different times of the day. So if they're in the lounge for a certain period of the day, what temperature is that at? And then when they move to their bedrooms, to come up with an overall kind of weighted average of the temperatures that the person experienced. So certainly the kind of movement part would be reasonably amenable to the Energy Plus type of modelling we've done. The clothing we could do something about in terms of the likely comfort levels that would be achieved by adapting your clothing. I think we could do less explicitly model. Well, we in the model we've got them on, we wouldn't be able to model explicitly drinks and bathing, but we of course should be including that in our overall kind of assessment in generating appropriate kind of guidance, working with the stakeholders. So hopefully that, yes, we are looking at resident behaviour, and we can, to a greater or lesser extent, depending on the particular behaviour, model it explicitly or not, but we would certainly include it in the overall kind of assessment and development of the guidance.
It might be as well that some of the providers taking part are already looking at some of these elements, like the food and drink, and they might be able to share some of their own data.
Yeah, that would be great.
And then there's a question here about have there been any studies on the impact of higher indoor temperatures on the ability of staff to do their jobs? So in terms of lost working days or reduced effectiveness. So do any metrics around that exist or data?
I'm aware that I've been leaping in first for each of the questions. April, do you want to take this one? I'm very happy to come in, but if you'd like to go first on this, I'm sorry, I'm very rudely leaping in first each time.
You're the professor. I think I am not aware of any studies on this, but I'd be interested in seeing them. I know that when we are looking at safety, we are also considering the safety of staff in our assessments, and we also are always very keen to hear from staff if they have any concerns they want to raise with us directly, and we do follow those up.
I was just going to say that in the kind of survey, in the interview work that Rajat and his colleagues did with the staff and the residents, even in the pilot study, it seemed that during periods of heat, when perhaps you would have intuitively thought that the residents would have said they were uncomfortable, they were perhaps less likely to say they were uncomfortable due to heat than the actual staff. But the staff were uncomfortable, they were hot. The residents weren't necessarily as uncomfortable, but the staff seemed to be prepared to put up with that. Because that was rightly or wrongly, that was there was kind of part of the way that that was being kind of operated for the benefit of the residents. So I think these different perceptions of comfort within the care homes is something, again, it was a very small sample, so we may not see that in the larger study, but it's something interesting, I think, too. And I haven't seen, it doesn't mean it doesn't, I haven't seen any studies which are explicitly looking at the days lost because of the staff, due to indoor temperatures, but there are various kind of metrics that do exist that we could apply the temperatures to make some estimates of that, and it would be interesting to see if that was backed up by these kind of wider set of interviews and surveys that we might be able to do with staff in this larger body in the main project. So again, a very good question, I think, and certainly something which we're interested in, of course.
Great. Well, unless you've got anything to add there, April, I think that we've kind of used up our time now for the discussion. So just thank you very much for that. It was a really interesting discussion. And I'm just going to share a final slide to introduce the next webinars. So a quick plug for these. So there's going to be a short break over Easter, and the next webinar is going to be on the 21st of April. And this is going to be about COP26 and the implications at an international, national and more local level for resilience. And then following that, 2 weeks later, on the 5th of May, Peter Hunter from the University of Stirling will be talking about his work through the programme on using Earth observation to assess climate-related impacts on water quality. And you can sign up for both webinars on our website. The recording and the slides for this webinar will be sent to everybody, and they'll also be available through the YouTube link on the website. So it just remains for me to say thanks again very much to Mike Davies and April Cole. Thanks very much for your inputs, really interesting, lots to discuss, and thanks very much for everybody's questions, and thank you for all for attending.
Great.
Bye.
Thank you.
Thanks everybody. Thank you. Bye-bye.
Bye.